Hello friends, I am Dr. Manju Sharma from Department of Pharmacology, Jamia Hamdard. Today we are going to discuss about various routes of drug administration. Under this topic, I will be introducing to you about various routes of drug administration, then various factors governing the selection of routes, classification, merits and demerits of the routes, dosage form applicable by various routes, special drug delivery system, and finally we will be concluding this chapter, routes of drug administration. Drugs can be administered upon or into the body by a variety of routes to produce effect locally or systemically. Drugs can be applied on the skin and mucous membrane to produce localized effects. This is called local route of administration. When drugs are given through mouth, that is oral route, or by injections, that is parenteral route, they are absorbed into the bloodstream and are distributed throughout the body fluids. Such an effect produced by the drug is called systemic effect. The choice of appropriate route in a given situation depends on both the drug as well as the patient-related factors. It is the feasibility and convenience that decide the route to be used. Now we will discuss about various factors governing the selection of routes. Number 1. Physical and chemical properties of the drug. Number 2. The site of desired action of the drug. It may be localized or systemic, approachable and non-approachable. Number 3. Rate and extent of absorption of drug from different routes. Number 4. Effect of digestive enzymes and liver metabolism on the drug. Number 5. Urgency with which the response is desired. Number 6. Accuracy of dosage required. And finally, the condition of patient. Like if the patient is unconscious and vomiting, you cannot give the drug by oral route. On the basis of pharmacological effects, the drugs may be produced localized effect or systemic effect. Therefore, the major routes of drug administration are: number 1, topical route, under which we have dermal and injection. Number 2, conjunctival, nasal and auditory. Number 3, vaginal, anal and urethral. The second type of route of drug administration are enteral routes, under which we have oral route, sublingual or buccal route and rectal route. The third type of route is parenteral route, under which we have injections like intravenous, intramuscular, intraperitoneal, subcutaneous, intrathecal, intramedullary, intraarterial, intraarticular, intracardiac and epidural. The next one is intranasal route of drug administration, then inhalational route of drug administration, and finally we have transdermal route of drug administration. Now we will discuss about all these routes of drug administration. The first one is topical route of drug administration, which is also known as local route. These routes can be used for desired localized effect at a specific site which is easily approachable. Thus, the drug affects mostly the part it comes in contact with without exposing the rest of the body. Consequently, there will be no or minimal systemic side effects or toxicity. However, it may be also absorbed from the site of application to the journal circulation. In suitable dosage form, some drugs which are absorbed from local site can act as systemic route of administration. For example, glyceryl trinitrate can be applied on the skin as ointment or transdermal patch. Topical administration involves in application of the drug to surface upon which it is intended to act. For example, on eyes, skin, ears, nose, throat, vagina, rectum. Drugs are locally administered on the skin or mucous membrane or serous membrane in form of lotions, liniments, ointment, creams, paste, paint, powders, sprays, drops, lozenges, suppositories or presseries. Drugs can also be dusted or sprayed over the surface of the skin and can be rubbed onto the skin. The site of application in such route of administration is the skin and mucous membrane. Now we will discuss about the various merit and demerits of this route of administration. The merits are: this route is convenient and safe, self-medication is possible. Demerits are: the amount of drug absorbed cannot be ascertained and the chances of systemic absorption if there has skin abrasions. The dosage form applicable by dermal route are various antibiotics, antifungal ointments, powders, solution, lotions, liniments, cream, etc. for their antiseptic, antipyretic and analgesic effect locally. Similarly, analgesic preparations are sprayed while antiseptic powders are dusted to provide local effect. The next one is conjunctival, nasal and auditory route. Here, the drugs are applied or instilled into the conjunctiva for local effect. The dosage form applicable by ophthalmic route are eye ointments, isotonic aqueous solution of drugs like sulfacetamide, chloramphenicol, gentamicin and ciprofloxacin. Drugs are either instilled or insufflate into nose or applied, sprayed or sometimes inhaled in the nasopharynx and tracheobronchial tree. In this nose, nasal drops are instilled whereas adrenaline is sprayed with the atomizer in the nasopharynx and tracheobronchia during asthma attacks. The dosage form applicable by nasal route are oxymetazoline nasal drops and nasal sprays as nasal decongestants. Drugs can also be administered as ear drops for the treatment of various ear infections. However, the absorption through mucous membrane can lead to systemic effects also. Then we also have vaginal, anal and urethral local routes. Various surface of the membranes are subjected to this local use. The dosage form applicable by this route are ointment, solution, emulsions, foam tablets, suppositories, pessaries of various sulfa drugs, antifungal drugs and metronidazole are used for local application into the vagina, while various drug solution and pencil-shaped bogies are available for urethral use. Second one is anterior routes. Anterior means intestine. When the drug is placed directly into the part of gastrointestinal tract, it is called anterior route. Under this, we have number 1 oral route. It is the oldest, convenient and most commonly used route of drug administration. Most of the drug after swallowing is absorbed from the small intestine because of large absorptive surface area. Majority of drugs given orally provide systemic effect excepting a few which are administered orally to provide local effect. Non-absorbable drugs given orally for action on GI mucosa, for example antacids and antidiarrheal drugs like sucralfate, norfloxacin, streptomycin, pectin and theolin. Such an action is also called as local action. Now the merit and demerits of this route. Oral route is safe and convenient. It is non-invasive, often painless. It is more economical as a sterilization of drug is not required. Self-medication is possible as the oral injection does not need any assistance. Both solid and liquid dosage form can be given orally. The demerit of oral routes are there will be slower and delayed onset of action, thus not suitable for emergencies. Irritant and unpalatable drugs like chloramphenicol cannot be administered. Oral administration may give rise to esophageal and sometimes gastric irritation like iron and NSAIDs, or sometimes leads to ulceration, nausea, vomiting and diarrhea. Other demerits include drugs cannot be given by this route to an unconscious, uncooperative and vomiting patient. It has slower rate of absorption and can lead to variable erratic absorption. Some drugs being highly polar like streptomycin may not be absorbed. Drugs that are destroyed by digestive juices like penicillin G, insulin, oxytocin and testosterone cannot be administered by this route. Drugs having first pass effect, those destroyed by liver before reaching the systemic circulation like morphine and isoprenaline are not preferred to be given by this route, and large doses of drug are required by this route. Various dosage form administrable by anterior route includes tablets, capsules, powders. The liquid dosage form are syrups, elixirs and mixtures. They are usually given orally. The next anterior route is sublingual or buccal route. The drug in form of a tablet is put under the tongue and is thus absorbed directly from the buccal mucosa into the systemic circulation through a sublingual route without passing through the liver. Hence, it does not undergo reduction in its potency. Some of the drugs that are highly lipid soluble get rapidly absorbed from the sublingual or buccal mucosa. Now we will discuss about the merits of sublingual route. There will be quicker onset of action and action is produced within minutes as absorption is relatively rapid. The buccal mucosa is being very vascular. After absorption, the drug passes directly into the systemic circulation, bypassing the portal circulation, thus avoiding first pass degradation. Drugs with high liver metabolism can be directly absorbed into the systemic circulation, and one can spit out the drug after the desired effect has been obtained. And if side effects are observed, this mode of administration can be adopted even in the presence of vomiting. The demerit of sublingual route includes only lipid-soluble and non-irritating drug can be administered by this route. Drugs of higher molecular weight are not absorbed by this route. If the drug is to be used in large amount and frequently, then also this route becomes inconvenient. Various dosage forms administrable by sublingual route include: the classical example is isosorbide dinitrate or nitroglycerin tablet for angina, nifedipine in liquid dosage form for hypertensive patient, and isoprenaline in case of asthma. Drug administered by this route provides systemic effect except for the use of antiseptic lozenges which provide local effect over buccal mucosa. Students, now we discuss about first pass metabolism. First pass metabolism can occur with all orally administered drugs. As you can see, the figure shown on the screen about first pass metabolism. Drugs administered intravenously enter directly into the systemic circulation and have direct access to the rest of the body, while the drugs which are administered orally are first exposed to the liver and may be extensively metabolized before reaching to the rest of the body. Now we will discuss about the rectal route. The drug is administered through rectum in form of a rectal suppository. Rectum has rich supply of blood and lymph which are useful for absorption of drug. Drugs administered by rectum can have both local as well as systemic effect after absorption. The enema, that is administration of liquid medicament per rectum for local use, is known as evacuant enema, whereas that for systemic use is called as retention enema. The rate of absorption of drug from the rectum is rather slow and the bioavailability is 80 to 90%. Therefore, the rectal dose is slightly higher than that of oral dose. This route can be useful in non-cooperating children or in presence of vomiting, migraine and motion sickness. This route is also useful when the patient is unconscious. However, it is rather inconvenient and embarrassing. Now, we will discuss about the merit and demerits of rectal route of drug administration. The merit includes: it can be useful for the patient having recurrent vomiting and nausea. It can be useful in case of non-cooperating children. The first pass degradation is relatively less. Certain gastric irritant and unpleasant drug can be administered through this route, while demerit includes chances of rectal inflammations are there. Absorption is irregular and often unpredictable. Though diazepam solution and paracetamol suppositories are rapidly and dependently absorbed by rectum, especially in children, it is inconvenient and embarrassing to the patient, and there may be often presence of feces which inhibit rectal absorption. Various dosage forms administrable by this route are: for local effects, Dulcolax and glycerin suppositories, enema and ointment for treating constipation, and for systemic effect, paracetamol, indomethacin, aminophylline, diazepam, ergotamine, and few other drugs are sometimes given rectally. Now we will discuss about parenteral routes. Drug administered by injections is conventionally referred to as parenteral route. Routes other than the enteral are called parenteral route. Par means beyond, enteral means intestine. Drug is injected directly into the tissue fluid or blood without having to cross the enteral mucosa. The examples are intravenous, intramuscular, intraperitoneal, subcutaneous. All these routes avoid first pass effect and thus the bioavailability is 100% because the whole of the administered drug enters into the systemic circulation. The injection, however, may be painful. Under this, the first is intravenous route. Drug is injected through lumen of the vein as a bolus, that is in instant injection, or infused slowly for example glucose, saline, oxytocin, noradrenaline, over hours in one of the superficial vein, mainly the antecubital vein. Drugs are given intravenously as aqueous solution or in very fine suspension. The intima of vein is insensitive and drug get diluted with blood. Therefore, even highly irritant drugs can be injected by IV route. However, the drug should not be irritant to the vascular endothelium. Care for intravenous injection. A superficial vein is selected, area is sterilized, and injection is administered with aseptic technique after aspirating blood and ensuring that the needle is in the vein. Only the required quantity is administered and the speed of administration is regulated. Air bubble should not find entry into the vein. Air bolus may prove fatal. Indication for intravenous route are as follows. Number 1. In medical emergencies or seriously ill patient, for example, adrenaline in case of shock and digoxin is given in case of cardiac failure. Then it is also used to restore the blood volume during blood transfusion, to maintain the blood volume, to maintain normal blood coagulability, and in chemotherapeutic drugs like antibiotic, antitoxic and antimicrobial agents. It is also used for selective swift route to avoid decomposition and irritation. This route is also used for general anesthesia and for diagnostic purpose. The contraindication for IV routes are insoluble suspension, oily injections and acidic solution, and various highly irritant drugs cannot be given. Faulty techniques and air bubble should also be avoided. Now we will discuss about the merit and demerit of IV route. This is the quickest route for the fastest action of the drug. Drug directly enter the systemic circulation bypassing the first pass degradation, 100% bioavailable, and less dose is required to achieve the desired plasma concentration. So it is valuable in emergency. This route can be employed even in unconscious, uncooperative and patients, those having nausea, vomiting and diarrhea. Hypertonic solutions and GIT irritant drugs can also be infused by this route. Large volume of fluids can be infused at a uniform rate by this route. Titration of dose with the response is also possible. The demerit of intravenous route includes strict aseptic conditions are needed and self-medication is not possible, painful and risky. Vital organs like heart, brain get exposed to higher concentration of drug. Any air or particle in the injection may prove fatal. Drugs in suspension and oily drugs cannot be administered by this route. As a result, there is no depot injections available for this route. Venous thrombosis and thrombophlebitis of vein and necrosis around the site of injection can also occur. Various dosage forms administrable by intravenous route include dextrose normal saline, dopamine, norepinephrine drips for IV infusions, and many antibiotics, barbiturates, diazepam, heparin, etc. All these are given by intravenous route. This route mainly provides systemic effects. Now, intramuscular injection. It is the commonest and convenient route of administering the injectable drugs. Injection is given either in arm, that is deltoid tricep, or in the thigh, that is gluteus maximus. The muscle has rich lymphatic and vascular supply, hence the absorption is very rapid. Muscular activity or massage increases the blood flow and so increases the rate of absorption. On the other hand, cardiovascular collapse or shock may impede the absorption. Aqueous solution of drug are more rapidly absorbed than oily suspensions or solutions. Depot preparations in oil can be injected by this route in order to prolong the duration of action of the drug. Prolonged duration of action can avoid frequent injections. For instance, medroxyprogesterone acetate is given one intramuscular injection every 90 days. Care is to be taken for intramuscular injection. For example, intramuscular injection must be given at safe site. The site of injection should be away from nerves and joints, otherwise there is a risk of nerve damage or disturbances in the movement. Ordinary injection should be given in superficial part of the muscle, whereas irritating and painful ones are to be given into the deeper part of the muscle. Volume of fluid should not be more than 10 ml. Intramuscular injection should be avoided in anticoagulant treated patients because it can cause local hematoma. Now we'll discuss about various merits and demerits of intramuscular injection. Merits include absorption of drugs is rapid, more predictable, less variable as compared to oral and subcutaneous route. Deports injection can also be given by this route for obtaining sustained drug effects. Mild irritants can be injected by this route as muscle is less richly supplied with sensory nerve. Demerit of intramuscular route. It is less painful, but self-injection is often impracticable because deep penetration is required. Strict aseptic conditions are needed. There are chances of abscesses at the site of injection and chances of nerve damage leading to paralysis of muscle. Large volumes also cannot be administered by intramuscular route. Dosage form administrable by intramuscular route includes the drugs like iron dextran, procaine penicillin, various antibiotics, antiemetics and depot injections of testosterone, neuroleptics are injected by this route. Now, intraperitoneal injection. In this mode of administration, the drug is injected into peritoneal cavity in the abdomen. The merit of this route include absorption of drug is rapid due to availability of larger surface area, while demerit is that aseptic conditions are required. An injection is often painful, risky due to chances of adhesion and infection in the peritoneum cavity. Dosage form administrable by intraperitoneal route are mainly used for administering dialyzing fluid for peritoneal dialysis in cases of poisoning and also in cases of renal failure. It is the most commonly used procedure for administering the drugs to the laboratory animals. Now, we'll discuss about subcutaneous route. This is the very simple method of injection. Patient themselves or their relatives may be taught to give subcutaneous injection. For example, insulin injection in case of diabetes. Drugs are injected into the subcutaneous tissue under the skin. Rate of absorption is slow than that of intramuscular injection. Subcutaneous tissue is supplied by large number of nerves, therefore irritant drugs cannot be injected, but at the same time it is less vascular. Absorption is slower than intramuscularly. Repositories or depot preparation that are aqueous suspension can be injected for prolonged and sustained action. Some special form of these routes are number 1, dermojet. This is a new needleless technique where high velocity jet of drug solution is projected from a microfine orifice using gun-like implement. The solution passes through superficial layers and get deposited in the subcutaneous tissue. It is essentially painless and suited for mass inoculations. The second special form are pellet implantation. The drug in form of solid pellet is introduced with a trocher and cannula. This provides sustained release of drug over weeks and months. Example, testosterone and deoxycortisone acetate. The third special form of this route is ciliastic, non-biodegradable and biodegradable implants. Crystalline drug is packed in tubes and capsules made of suitable material and implanted under the skin. Slow and steady leaching of the drug occurs over months, providing a constant blood level. The non-biodegradable implant has to be removed later, but not the biodegradable one. This route has tried for hormones and contraceptives. Now we will discuss about merit and demerit of subcutaneous route. The merits are self-injection is possible because deeper penetration is not needed, slower but steady absorption for longer period compared to intravenous or intramuscular route. Depot injections and implant of a drug can also be made. The demerit of subcutaneous route are irritant drugs cannot be injected as necrosis may occur, suitable for only small volume of drug, maximum up to 1 ml, not suitable for shock patient who are vasoconstricted and absorption will be delayed. Various dosage form administrable by subcutaneous route are local anesthetic for local effect, insulin for systemic effect. Vaccines are administered preferably by this route as the active protein reaches lymphoid tissue directly through lymphatics without getting destroyed elsewhere in the body. Matchstick size implants of hormonal contraceptives are also available by this route. Now we will discuss about intrathecal or intraspinal route of drug administration. Drug is administered in the lower lumbar region into the subarachnoid space surrounding the spinal cord, bypassing the blood-brain barrier and the blood-CSF barrier. Thus, significant CSF levels are provided which otherwise are not possible by any other route. Most of the operations below the umbilicus are performed nowadays under spinal anesthesia. The drugs so introduced intrathecally act directly on the nervous system. Now we will discuss the merit and demerit of this route of administration. The merit include the drug can directly act on meninges and spinal cord. Demerit of intrathecal route are: number 1, strict aseptic condition and great expertise is needed to give such injections, and it is a painful and risky procedure. The dosage form administrable by intrathecal route are xylocaine injections for providing spinal anesthesia, many diagnostic agent, radiopaque contrast media for myelography are also given by this route. They mainly provide local effect, but certain antibiotics used to treat meningitis do provide systemic effect when given by this route. Now, the intramedullary injection. Drug is injected into the medullary cavity of the tibial or sterna bone. When intravenous injection are not possible, glucose and saline solution, plasma, blood transfusion, etc. can be easily administered by this route, especially in children. This route is rarely used. Merit: onset of action is very fast as the vascular space of bone marrow communicate directly with the large veins. Demerit include strict aseptic condition is required. This is risky and painful, and skill is also needed to give such injections. Now we will discuss about transdermal route of drug administration. This consists of devices in form of adhesive patches of various shapes and size which deliver the contained drug at constant rate into systemic circulation. The drug in form of solution or bound to a polymer is held in reservoir between an occlusive backing film and a rate controlling micropore membrane, under the surface of which is smeared with adhesive impregnated with drug. The adhesive layer is protected by another film that is to be peeled off just before application. The drug is delivered by diffusion or percutaneous absorption into the circulation. The rate of absorption depends upon the degree of hydration, keratinization, and rate of blood flow through the skin. A single plaster can ensure continuous low grade absorption up to 1 to 3 days. The merits of this route include: it is more convenient and many patients prefer transdermal patches to oral tablet for the same drug, so patient compliance is better. It bypasses first pass hepatic inactivation, and slow but sustained release of drug is there for several days. The demerit include: transdermal patches are more expensive and local irritation and erythema may occur in some, but generally mild. Site of application can be changed. Discontinuation has been necessary in few cases. Dosage which are administrable by transdermal route include transdermal patches of nitroglycerin for angina, hyoscine scopolamine patches for motion sickness, clonidine for hypertensive patients. All are used for systemic effects. Special drug delivery systems. In addition to the various routes of drug administration we have discussed, there are some new drug delivery systems which are being developed to suit the need of the patient and disease. For example, mini pumps for delivery of insulin in a diabetic patient. An implantable mini pump is being used to administer insulin in patient of diabetes. There is a continuous glucose monitoring system along with the mini pump, and this is the feedback control system which aid the glucose sensor which regulate auto insulin injection as per blood glucose level. Now, conclusions of various routes of drug administration. Drugs can be administered to produce its effect systemically or locally. Routes can be broadly divided into those for local action and systemic action. The major routes of drug administration are enteral route, parenteral route and topical route. And the factors which decides various route of drug administration are the physiochemical property of the drug, disease, the condition of patient, the feasibility and convenience. Each route has its advantages and limitations. The onset and duration of a drug depends upon the route of administration. For example, intravenous route produces quickest onset of action and long duration of action as compared to oral route. Some new drug delivery systems are also being developed to suit the need of the patient and diseases. For example, implants, mini pumps and dermojet, etc. Thank you.